So you've been searching YouTube, you've been scrolling, trying to find something that you can do for your tinnitus, this annoying sound that just won't go, that's torturing you. Well, in this video, I'd like to show you what we do, what we can actually do to reduce it down. It's not a cure, but it's an amazing treatment. Can't cure a cold, can we? But we can treat it. We have a way of treating tinnitus. In this video, I'm going to talk about where it can be, where is your tinnitus coming from, how do we actually do something to treat it, how do we find it, how do we target it, what do we have in our armoury, in our arsenal to combat this really horrible condition. Well, there is hope. It's really easy to be cynical about this, kind of silly for me to say this, but how about I go through everything we do as a company, everything I do as a sound engineer and an audiologist to actually target it, find it, reduce it down, make your life a bit easier, a bit of peace maybe. So you've been searching for something you can do regarding tinnitus, that annoying whooshing, buzzing, ringing sound that won't go away, and probably been scrolling to try and find something you can do to put it right. Is there anything you can do to stop this agonizing sound in your head? Or maybe you know someone who's got this problem, you just want to help them. Well, there's no DIY cure. You need actual help, and there is actual help you can get. This is the video for you. You may have seen countless others, but how about I give you some actual answers, something you can do to put it right, maybe see someone who can help you. So, I'm Lee Fletcher, audiologist and sound engineer from a long time ago. It's relevant. And I want to go through in this video what I've done for 21 years to actually help people, actually help someone who's got tinnitus and they'd kind of like it to be reduced down or even gone. That's what I've done. Might sound scammy to you, like a lot of these videos, but I'll talk about it in detail that you wouldn't have heard from anyone else, because we kind of invented this in our little corner of England in the southeast. So let me go through some of these things with you, explain a little bit about what tinnitus is and how we've targeted it and what we do to actually try and calm it, because I imagine that would be kind of useful for you. Would you like your tinnitus to be reduced down? Well, let me explain a little bit about it. So, tinnitus is an unwanted sound, internal. It's not an external sound. It's not coming from somewhere else. A lot of people with tinnitus say, can you hear that? No, they won't be able to hear that. It's in your head. It's in your ears. It's coming normally from your ears. 3 parts of the ears. So it could originate from 3 parts. Let me quickly show you on screen. So, 3 parts of the ears. You've got ear canal, middle ear, inner ear. So the tinnitus can start from the eardrums if there's a problem with the eardrums. It can actually originate from the 3 hearing bones, smallest bones in the human body, called the ossicles. Or more likely, it can originate from the inner ear. Not always, but you need to see someone to eliminate. Like, where is it? Go and see someone to at least diagnose it. You have to make sure they know a little bit about tinnitus. So if you came to see me, what I would do is go through the 3 elements of the ears using diagnostic equipment. So I'm going to explain how we cancel it, because that's why you're here. But before that, let's just go through a little bit of the background. I do this every day, and you can be as cynical as you like, but I've got people who now walk around without tinnitus in their ears, which is an amazing thing. So it's noise cancelling, it's quite clever, it's different from the headphones or the earphones that you may use. We've got to find where it is. Where is that needle in the haystack? The ear is an incredibly complex organ, one of the most complex organs in the human body. So we want to figure out, is it coming from the eardrum? So to do that, we check, we look, we have a look at it and go, yeah, it seems all right, or maybe not. What if you could actually use a piece of equipment that could diagnose that? Tympanometer, ear pressure tests. Normally ENT departments within hospitals in the UK that have these, and all over the world actually. So this will test the pressure of your eardrum, and sometimes you'll get an unusual result. So that's a fairly typical result there. Won't bother explaining too much about it. That's not a typical result. That's the result of an eardrum that's quite loose. That can cause a problem. You don't always know exactly where tinnitus comes from. I can't get inside your head and listen to it. I have to go with what you're telling me. But this helps. So that will tell me if your eardrum may be causing a problem. Any kind of blockage, there might be wax in your ears. Whoever thought that? Get someone to maybe look in your ears, just in case the blockage causes tinnitus, because it stops movement and it can cause a reaction, which is tinnitus, ringing, buzzing, whooshing, hissing, all these things. So you want to eliminate that. You want to eliminate the blockage that is created by the eardrum not working very well, or being too loose, too floppy, whatever it is. Middle ear, very important. 3 smallest bones in the human body. A tinnitus can arise from there. It can be some kind of weird vibration thing going on. There's so many things that it could be. I won't bore you with all of them, but we've got a test for this. High frequency hearing test and a bone conduction test. I'll explain what this is. So if you went to see an audiologist, you'd get a fairly standard hearing test. Nothing wrong with that. From 125 Hertz to 8,000 Hertz. This is relevant. That tells us if you've got a hearing loss. Most of the time, most tinnitus is related to hearing loss. Could be that. So should we find out? I like to test at a greater frequency range. I want to test your hearing to failure, because guess what? The most likely element of what causes tinnitus is hearing loss, and it might be outside the range. You might have normal hearing, could be absolutely fine, but what if it's in that range? It's called hidden hearing loss. I don't call it that, I call it hearing loss, but I want to know where is the most likely area for your tinnitus to be, and a lot of the time it's higher frequency. Here, this screen shows an audiogram that goes beyond 8,000 Hertz. This is relevant. A lot of tinnitus occurs between 8 and 12,000 Hertz. So you need a test. You really should get a test that goes above 8,000 Hertz into that region where you normally find, that's the worst element of the hearing, and that's where the tinnitus is located. So let's find it, shall we? Let's find where your tinnitus is and target it. If we can target it, we can help reduce it down using clever noise cancelling techniques. So we've got these devices that we can put in your ears and really target it. So if it is in this section, the cochlear region of your hearing, it's more likely to be at the entrance. That's where the high frequency hair cells are. And I will get on to what we do to calm them down, because this is what's likely causing your problem. Likely. You just need someone to tell you. Find someone who can tell you. Come to us. I do it every day, getting quite good at it now. So if the hair cells at the entrance of the cochlea are the ones to blame, which is the most likely cause of your tinnitus, let me show you. So if I put this screen up, they start to look like this. There should be 20,000 of these, by the way, 20,000 in the cochlear region. But we get what's called the doormat effect. So sound turns from sound waves to vibrations back into sound waves in fluid, the cochlear region. All sound waves enter here and trample over the high frequency hair cells. That's just us getting a bit older, really. Some are more susceptible than others, especially if you worked in noise or experienced noise. So if these guys have fallen over, sometimes they can start moving of their own accord. This is the first theory of tinnitus, that there's this movement sending a sound through the auditory nerve, where the auditory cortex in the brain picks it up, this unwanted sound, whatever that sound is, more likely to be at the entrance, and they look like this. So that reaction, it's like an impulse, a misfire, these nerves doing this, all the time, annoying the hell out of you, sending impulses through the nerve, auditory nerve, to your brain. The brain picks it up. Now, that was always what I went with for a long time. That was a theory of tinnitus that was accepted. It's a misfire, not in quite layman terms like that, but the hair cells are doing it. The high frequency hair cells are moving, they're doing something, alerting a problem. 1 in 5 people get tinnitus related to some kind of hearing loss. 20% club, that's what you're in. 80% of people don't get this problem relating to their hair cells. So it could be other reasons, like I said earlier, you need to find out. But if it is that, then 20% of you are experiencing this annoying sound because these hair cells are moving. Now, these theories combined, there's another theory that I quite like, which is to do with the brain filling in the gap filling. It's producing its own sound. Now, if there's something wrong, the brain can sometimes do this. If you think of phantom limb syndrome, where someone's had an amputation but they still feel pain in their arm, or they can wiggle their toes, they're not there, but the brain is sending out scouts to find it. Where's this missing element? And they'll swear blind that they can feel it because the brain's reporting it. So I like this combination of theories. Hair cells spark off sound, brain picks it up, or picks up a problem, sends out scouts down the auditory nerve, because the auditory nerve is a two-way street. A lot of us used to think it was a one-way street, but no. Sound comes back down the auditory nerve and re-stimulates the hair cells. And all of this may be a little bit dull or uninteresting. Come on, get to the good bit, but I may as well tell you what's going on. We found it. So the brain fills in this gap, and it's like phantom limb syndrome. It just keeps going round in a feedback loop, re-stimulating these hair cells. Difficult with theories, isn't it? That's how we understand it, or a lot of us understand it. I want to break the feedback loop. Just like being on stage with a microphone and cover it, or gets too close to a speaker and you get this high-pitched sound. So this is an internal feedback loop. It just keeps going on and on, getting worse if the hair cells fall down anymore. You may start noticing you're not hearing that well because all you've got is this sound in your head. Be nice if we can just reduce that sound so you could hear better. So we developed some really clever techniques. What I would do is the test I just described to you. Let's find out where the problem is. You probably see these little bars going behind me. So we've got really clever ways of actually targeting the sound using the same type of technology as hearing aid manufacturers. So all this equipment here that I have is designed to try and focus where is it. We'll put some speakers in your ears, try and find it. Go through a pinpointing test. So we developed these really clever ways of treating tinnitus using techniques born of treating hearing loss. So people came to us with problems with their hearing. Oh, I've also got tinnitus. Pretty much every audiologist will say, well, we can't really treat that, but you can get, I don't know, sleep management help. You might get some kind of help with counselling, coping mechanisms, distraction techniques, all of these sorts of things. So we found we could actually find where the tinnitus was and help reduce it down using hearing aid technology. So a lot of the time hearing aids can help with tinnitus. Put hearing aids in, kind of reduces it down, but that's a bit vague. I mean, it's a bit hit and hope. Go and get yourself some hearing aids. It's not really a first port of call when it comes to trying to help your tinnitus. Maybe you've got a problem with both. Great. But there's plenty of people that don't have much hearing loss, but they do want to treat their tinnitus. And we meet them and we help them using quite clever techniques. So we establish which hair cells, to the best of our knowledge or opinion, whatever, are causing the problem. we then target them with a very specific sound. Now you may have tried white noise, ocean waves, pink noise, brown noise, all these different sounds that you may have searched for the internet to find. Maybe you've got a few apps on your phone, maybe they help a little bit, but they're not actually necessarily treating the problem. They are maybe masking it. So some of these techniques that audiologists use to help tinnitus are using tinnitus masking, where you might just replace your tinnitus with another sound. I get it, if it's screaming torture, yeah. I've had clients myself from years ago that quite liked using white noise, for example. It's not how I want to do it. This isn't necessarily the best way, I think, of treating tinnitus. It's just putting a sticky plaster on it. Okay, it might sometimes help. For my tinnitus sufferers with catastrophic tinnitus, yes, that is a denomination, if you like, of a categorization of tinnitus. They might have something that they use as well as what we try and do to suppress it. They might have something to help them, but it's rare. Most of the time now, what I do is try and target it. And if I can target it, if I can find where it is with your help working together, then we can suppress it using a really clever sound. Really clever. So this brings me on to sound engineering. I achieved a degree years ago, creative music technology, which is essentially sound engineering. But the creative word is really interesting because it teaches you to think a bit differently. So I've recorded so many songs, bands, recorded music, mixed music. I know a lot about sound, acoustics of sound, microphones, speakers, amplifiers, lots of things that are in hearing aids, weirdly. But this is what allowed me to look at things a little differently when it comes to, well, what's going on with tinnitus, where is it? It's not just the audiology degree that I've got, it's sound engineering. And that's what came into its own. I started seeing patterns from people who came to see me who wanted help. And they tended to be the ones with hearing loss, and then I'd treat their tinnitus as well, almost by fluke. So I'd give them a sound, they'd use it, and they'd come back to me saying, you know, you tuned that sound for me. Why is my tinnitus a bit better? To which, wasn't sure. Are you imagining it? Is it really better? So we've got a lot of audiologists in our company, my wife being one of them, and she'd always think I was maybe riding a wave of enthusiasm, who knows? But when she started getting results from this, we developed something. Now we can treat tinnitus with people who haven't got hearing loss as well. Wonderful. But you've got to find it first. So if you were sat here with me, I'd be going through a whole load of things to establish where it is. Using more sound engineering techniques than audiology techniques, because this does not exist. There's no training. I struggle myself to train people in this, still manage it, but there's no professor of audiology that would be able to tell you how to use technology to reduce down tinnitus. So there's a separation between audiology and sound engineering, obviously. I just happened to put it together because I flukily became an audiologist. Therefore, I notice things. I'm quite good at programming hearing aids, different story, but like that's a whole another animal, and it's wonderful to have something you can do to help people with hearing loss. You treat the problem way more effectively and accurately and precisely using different types of techniques. So that's what I've been doing for 21 years. 2010 started our company. So Regain Hearing was formed, and we could start to do things a little differently because we could use any product, and we could start to give people more time. Time's important. 2016, hearing aid manufacturers came up with tinnitus masking in their hearing aids, give remote control. Use some sound waves, some ocean noise, or it might be wind noise, or maybe white noise. That was okay, but like I said, I don't want to just replace your tinnitus with something else. I want to reduce it. So these sound cancellation techniques, cancelling the tinnitus, came about via that. It's now its own animal. So if you came to see me, first I want to find out the offending areas. What's causing the tinnitus? Most likely hair cells, but not always. It might be something in your eardrums. It might be middle ear. We'll find out. Then I can put something in your ears, and within normally about half an hour I can have an effect on it. Imagine that. Imagine not really hearing your tinnitus as loudly within like half an hour. It's a little difficult to describe to you, but I want to break that feedback loop. I want to disrupt it. We're disrupting and we are treating something at the same time. So you do it twice a day. We find a sound, you put the sound on for half an hour, maybe in the morning, half an hour in the evening, kind of whatever suits you. And by targeting your sound using our sound with clever technology, it reduces it down. Surely that's worth looking into, and it'd be kind of silly for me to go through an explanation like this if I didn't have hundreds of people that I've helped in the past. So it can help you. I don't know if you can get to one of our locations. We've got 11 of them now in the southeast, but there's one way to find out. Book a consultation and we can go through it. And I can make more sense than I'm trying to make now. But this is genuinely what we do. About an hour and a half consultation. Really get into it. Maybe your tinnitus isn't that bad. Fine. If your tinnitus isn't that bad, don't worry about it. Maybe have a test to see where it is. But if you'd like to actually reduce it down, we can go through this and I can show you. I can explain how we do it, and it takes a few appointments, etc. And it really does depend on what type of tinnitus it is to the cost. It's not astronomical. There's so many different types of tinnitus, so many different types of products that we use. So I might not be able to help. That happens sometimes, but rare. Try and remember the last time I couldn't help someone. A long time ago. So why not? Come and sit down with me. Let's get to it. Find out for yourself what we can do to reduce it down. You never know. How nice would it be to stop this torture in your head and actually do something about it?